This is going to be a brief overview of diabetes. We're not going to get into the weeds on a lot of the technicalities, but just kind of make sure you have a basic understanding of how it works, what the symptoms are, the difference between type 1 and type 2, and things like that. So what is diabetes? Basically, it's when the body does not have the ability to regulate blood glucose levels, and the blood glucose levels will bounce between too high and too low. So in someone without diabetes, let's talk about how a healthy body works first so we can kind of understand what's supposed to be happening. So when you don't have diabetes, every time your blood glucose levels rise, usually because you've eaten something, or it could be because of stress, but usually because you've eaten something, the pancreas releases insulin into the bloodstream. The insulin is basically like a key to open the cells. So the insulin and the glucose are in the bloodstream. The insulin, when it reaches the cells, it basically opens them up to allow that blood glucose to go from the blood into the tissues. You know, your tissues use that glucose to basically turn it into energy so they can function. So when that glucose leaves the blood and goes into the tissues, that lowers the blood glucose level back down. So essentially, blood glucose goes up just a little bit. Our body releases insulin. That insulin opens up the cells to let the glucose go from the blood into the body or the tissues of the body. And then those blood glucose levels settle back down. So there's always this tiny little peak of blood glucose, and then it comes back down. And our body kind of works well to regulate that blood glucose level by releasing the right amount of insulin. So throughout this, just kind of remember insulin is kind of like a key that's opening the cells so the glucose can get into the tissues and get out of the bloodstream. When somebody has diabetes, there's some kind of problem with this system. So with type 1 diabetes, basically they don't have the keys. In other words, they don't have insulin in their body. Their pancreas is unable to produce insulin. So there's no way to open up the cells. So that glucose just stays in their blood, and it can't go from their blood to their tissues. It just stays in the blood. Type 2 diabetes, kind of a different way for the system to break down. In this case, we have the keys, but the locks are worn out or not working. So the cells aren't able to be opened up so that glucose can go from the blood to the cells. So a little bit more about that. Type 1 diabetes is congenital, or sometimes it's caused by like a virus that damages the pancreas. But the combining factor is that the pancreas does not produce insulin at all. So type 1 diabetic has no insulin, and their body is just not able to produce insulin. And it can be, like I said, for various reasons, but they don't have any insulin. And so they're what we call insulin dependent, meaning they have to have insulin to survive, because without insulin, the glucose is just going to stay in their bloodstream, which is going to give them a high blood sugar level. But more importantly, their tissues are not going to be able to get that sugar that it needs because they don't have any insulin. So they need insulin to survive. Now, type 1 diabetes, they used to call this childhood diabetes because it does commonly come on during childhood, but it really can happen quite late in life. I have come across several people who were diagnosed. They just got type 1 diabetes in their mid 30s, even early 40s. So this can happen, it's getting later and later where this kind of thing can happen. Type 2 diabetes, on the other hand, is caused by lifestyle. Basically, the blood sugar is constantly high, and the pancreas is constantly releasing insulin, and those receptors get worn out. So if you think of it as basically the lock itself is getting worn out because the key's been used so many times to open up the cells, that those receptors are worn out and doesn't really work very well. So in the early stages of type 2 diabetes, the patients may be able to control their blood sugar level with oral medications. There are just some medications that basically make those locks work a little better. Later stages, they sometimes will take insulin, because basically, even though the lock's not working, we'll throw a bunch of keys at it, and maybe one of those keys will help open the cell, kind of to put it simply. So type 1 are usually going to be more insulin dependent, but type 2, they may also be taking insulin as well to keep their blood sugar down. So when we're looking at blood glucose levels, remember a normal blood glucose ranges from 80 to 120, basically right around that 100 mark. When the blood sugar, drops below 60, you'll usually start to see symptoms of low blood glucose levels. Now, if you have somebody who's a type 1 diabetic or a type 2 diabetic and they have low blood sugar quite often, they'll kind of get better at having low blood sugar. So, if they've had type 1 diabetes their whole life since they were a child, they may be walking around talking to you and acting totally normal with a blood glucose of 40, but they might be able to tell you as well, my blood sugar is kind of low. They can kind of feel it. They can kind of adapt to it. They basically are used to feeling that way, and they can kind of go on and function normally. They still need glucose to get their blood glucose level up, but it may not be as obvious in somebody who's had this for a long time. And then on the other end of the spectrum, we usually start to see symptoms for high blood sugar when it's above 400. So that's a huge gap. So when it's down around, 60, that happens really quickly for that blood sugar to drop from, maybe it's at 100 and it drops down to 60. That happens a lot faster than their blood sugar is at 100 and it goes up to 400. So those low blood sugar levels are a lot more dangerous and much more of an emergency than those high blood glucose levels. So remember, if their blood glucose is low, they need sugar, preferably oral glucose. We carry that. That's something that's usually going to be in your standing orders. You can give oral glucose. But of course, to give that oral glucose, we have to put that in their mouth. So they have to be able to protect their airway. Before you give it, you want to make sure, you ask them, can you swallow? Make sure they're able to swallow on their own. If they're, falling asleep or kind of, dozing on and off or drooling because they're not really able to swallow on their own, you're not going to be able to give them that oral glucose because you can't put that in their mouth at that time. So if they can't protect their airway, call for ALS. ALS can come and give glucagon and things like that they can give intramuscularly or through an IV for that patient who can't protect their airway. Now, basically before 2019, that was the end of the story. You needed ALS. As it stands right now with, at least with our local protocols, that's still the case. However, there is a new medication on the market that a lot of people don't really know about it. I'll be honest with you, I learned it from my friends who are type 1 diabetics. I have not learned anything about it from the medical community yet. Even a lot of ER doctors and things like that are still have not learned about this medication. It's just something that's being prescribed by endocrinologists. But there's a new thing on the market called Baqsimi, and I have a picture of it that I took from one of my friends who's a type 1. And this is what it looks like. And Baqsimi is basically a nasal spray that's glucose or glucagon. And so, we haven't trained in this yet. So if it's not in your protocols, you can't really give it, but you may want to consider, asking, what if we come across a patient with Baqsimi, to your medical director? You may give them a call and it may be something that they allow you to use, because this is something that's kind of becoming more common, but it came out in 2019. So as of the making of this video, it's 2023. 4 years seems like a long time, but in the medical world, it usually takes about 10 years for these things to make their way into the training and into the protocols and things like that. But hopefully soon, this will be something we can give to help people. Since it's a nasal spray, they don't need to be conscious. As you can see, there are directions on the side of the bottle for how to give it. It's basically like giving somebody Narcan or naloxone. You're going to squirt it in their nose. It'll raise their blood glucose levels. Now, if somebody has high blood glucose levels, they're up above 400 and they're symptomatic, they need insulin. And basically the only way to give them insulin is to get them to the hospital. Even ALS cannot give insulin in the field. One of the reasons is that it's really not as immediate of an emergency. Having high blood glucose levels over long periods of times causes a lot of problem, but one time of that blood glucose being up is not usually going to be the issue. So just get them to the hospital if they have that high blood glucose, or again, for now, if they have that low blood glucose level and they can't protect their airway, same thing. We need to get them to the hospital or rendezvous with ALS. One small other thing you may come across with diabetes is somebody who has undiagnosed type 1 diabetes. So probably a child, but it could be somebody in their 20s, 30s, or even early 40s these days. They have type 1 diabetes and they don't know it. So they're not checking their blood sugar levels and they don't know if it's high or low or whatever. Well, if they are undiagnosed, that means they're not taking any insulin. So their blood sugar is going to be extremely high. Because remember, there's no way for their body to use up that sugar that's in their blood. So it's going to stay in their blood and they're going to have extremely high blood glucose levels. So if you check their blood sugar, that'll be the easiest way to know. But the symptoms that would make you suspect that is they'll be losing weight, but also eating a ton of food. If you eat food, but then your body can't use the sugar in the food for energy, you're not going to gain weight. Basically, your tissues are going to start to they're basically going to feel famished. So they're going to be starving and asking for tons of food, eating a ton of food, and at the same time losing weight. Same thing with thirst. Basically, to get that blood sugar out, to get that sugar out of their blood, to get that blood glucose level down, their body can't use it, so it has to get out some way. How do we get things out of our blood that aren't supposed to be there? Our kidneys filter it out. So their kidneys are going to be filtering out all of that sugar into their urine. So they're going to have a ton of glucose in their urine, which is going to make them pee a lot. And because they're peeing a lot, they're going to be thirsty a lot. They're basically going to be dehydrated, or really they'll be overly hydrated because they'll be constantly drinking water. It's not uncommon for them to be drinking like 3 or 4 gallons of water a day. They're just constantly chugging water and constantly peeing, trying to get that sugar out. You know, type 1 undiagnosed might be the place that you'd be most likely to see what we call DKA or diabetic ketoacidosis. But you could see that in anybody that has high blood sugar as well. And in addition to peeing off that sugar, they may also be trying to basically breathe it off. And they'll have that deep, rapid breathing, almost like a dog that's panting. So if you have somebody with that deep, rapid breathing, that would be another time to make sure you check their blood sugar levels. And again, if their blood sugar is really high, there's nothing we can do in the field, but it'll at least tell you this is an emergency. I need to get them transported. So I think those are the big highlights for diabetes, and I'll see you in the next video. Thank you.